Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to demonstrate some techniques for scar tissue massage and maintaining good scar health, mobility, and appearance after knee replacement surgery. Hey everyone, so first let's talk about some of the benefits and reasons why you might want to do scar tissue massage and mobility techniques after knee replacement surgery, and then we'll transition and I'll show you some of the techniques that you can do with your scar and massaging it and mobilizing the tissues. So scar tissue massage has a lot of benefits. The research and the literature on these benefits and potential benefits is inconclusive, I'd say incomplete. They don't necessarily know the extent of these benefits, but there are a lot of potential benefits that can come from using scar tissue massage after knee replacement surgery. So some of those benefits include helping to realign the collagen and the connective tissue or scar tissue that's developing both around and underneath your scar after surgery. It also is really helpful for draining fluid that can accumulate around the scar and at the skin, but also within the knee joint and around the knee. It's really helpful for blood flow and increasing blood flow to that area, which again is going to help speed up and increase the efficiency of healing of the soft tissue and the remodeling of that tissue that's being laid down. And it's really beneficial, probably one of the more important benefits of scar tissue massage is it helps improve the elasticity and mobility of your skin and that superficial layer of soft tissue around the scar and at the scar. And that's really going to be important for your range of motion and mobility with different movements and being able to tolerate different movements. It really helps with tolerating, for example, when you bend the knee to a far range of motion or pretty significantly, a lot of times that can be really uncomfortable and feel like a pulling sensation at that scar. And the massage can help to decrease that pain and that sensation of discomfort so that you can tolerate the bending exercises a little bit better. So a couple of things to keep in mind is that just general health and things that can help with the scar, the tissue healing, the scar tissue healing, the remodeling and laying down of collagen fibers, that connective tissue. One thing is you need to stay hydrated. Staying hydrated is very helpful for the mobility of the skin and the elasticity of the skin and the tissues. Also getting plenty of calcium and vitamin C in your diet or through supplements can be helpful as well. So the main thing though is, for better or worse, is that in terms of the appearance of the scar and in terms of the just general mobility of the scar, a lot of it's going to boil down to your genetic makeup. So something to keep in mind is, as much as we want to affect the healing and improve the healing, a lot of it's just going to boil down to your genetics and the biology of your body. So the best time to start doing scar tissue massage is usually 2 to 4 weeks out from surgery. This allows time for that scar to close, so it's no longer an open incision, it's no longer a scab, but it's a closed, the soft tissue is closed off completely. And it also gives a little time for some of that superficial tissue to heal a little bit so that it won't be damaged or harmed by any of the pressure that you're putting on as you perform the scar tissue massage. So with that being said, let's jump into how exactly to do some of the different techniques. And before I do that, make sure you hit that like button, subscribe if you don't already to catch all of our videos. We post regular content, everything related to knee replacement surgery. Leave your comments and questions below. With that being said, let's go ahead and transition to some of the different techniques. Okay, so now we're going to take a look at some of the different techniques for performing scar tissue massage. So right now, for positioning, I'm sitting on a therapy table. My leg is underneath a rolled up towel, so not completely straight. has a little bend in it, and then it's kind of laying out on the surface. So for example, you could do this on the sofa, you could do this on your bed, or it's also perfectly okay to do it from sitting in a chair as well. Wherever you feel just comfortable and relaxed is going to be the best thing. Now, when you do scar tissue massage, it can be really helpful to have some sort of lotion, cream, or oil that you can use on your hands and fingertips to just help provide a little smoother motion, a little smoother movement while you're massaging. There are some certain creams and lotions out there that have coconut oil or vitamin E in them, and this potentially can be beneficial to help with the collagen formation and tissue repair, but the benefits and the extent of those benefits are inconclusive in the research, but potentially can have some helpful benefits with something with some coconut oil or vitamin E involved in it. Now, I'm going to show you a couple of different techniques. So you see here, this is my drawn on, my knee replacement scar. Again, you want to wait till the scar is closed off completely before you start doing any of these techniques, and wait a little bit, 2 to 4 weeks after surgery, just so some of that superficial tissue has a little bit of time to heal and recover, and you're not doing any undue harm or damage to the area. Now, you want to focus on using a firm pressure, so kind of a pressure that allows it to blanch. So what that means, if you push down and if you let your hand off, then you'll see that white spot, but then the white spot will go away quickly. You don't want to be super intense pushing down, because that might be uncomfortable and painful, and you don't want to be too light and you won't really get too much benefit from it. So put just a little bit of cream, a moderate amount of cream, doesn't have to be too much, on your fingers, and we'll just go over some of the techniques. So you really want to focus on, again, that firm pressure with just slow, continuous motions. And you can really use any motion that you want. You can do small circles, you can do big up and down or side to side motions. Really, as long as it's slow, continuous, and firm, that moderate firmness, that can be beneficial and okay. So a couple of different things that I like to do is, one is just going longitudinal up and down the scar. So I go on the sides of the scar, and I like to use my thumbs a lot of the times, but you can use your index and middle finger. You can use all your fingers, really, if you'd like. It's just finding what kind of is comfortable and works for you, as long as you can keep that pressure on. So for example, I might start at the top of the scar, and I'll just go nice and slowly down the length of the scar. And I might do that maybe 5 or 10 times. And now you might say, well, don't you want to go the other way to get a little bit of that benefit of bringing the swelling and fluid up the leg? And that might be a little bit more benefit. So you can also go longitudinal up toward the head as well, just going both ways. And I like to work out a little bit, kind of do at the scar and around the scar. You can even go directly over the scar. Some of these will take a little bit of time to build up a tolerance that you'll feel okay doing it. It might be a little painful or uncomfortable, and that's normal, that's okay. We can also do cross friction, so starting maybe at the top and just going side to side. Spending 30 seconds or so, I'm going to start to rub off the scar here. And just going side to side. I like to use one hand as kind of giving the massage, and the other hand keeps that in place, because if you notice, if you just have the one hand, it'll just kind of move the skin back and forth. But if you keep one hand to hold the skin in place a little bit better, and then you can just do that massage over a certain area with the other hand. And so that's kind of the cross friction massage, we call it. And you can also do just little circles, so holding an area and doing little circles. Spending 30 seconds to a minute in each area. Doesn't have to be super long. The max amount of time is maybe 5 minutes or so. You don't have to spend much longer than that doing this. Early on, you do a little bit more frequently, maybe once a day or twice a day. and then periodically over time, reduce the frequency to once a day, once every other day, to maybe a couple times a week eventually. So that's kind of small circles like that. Another one I like to do is just kind of a bunching technique. So going on each side of the scar and just bunching that skin up, kind of pinching it up a little bit like this. Just another way to start to improve that elasticity, decrease some of the sensitivity of the scar. So that's most of the techniques. So the longitudinal, the cross friction, circles, but you can be creative. You can find other techniques. It's just about maintaining that firm pressure and just doing those slow, continuous motions. That's the key points. And using some sort of cream or lotion can help move the hands and fingers a little bit smoother and a little bit more comfortably and tolerably. If you find a spot that's a little more stiff or more uncomfortable, you can stay at that spot and work on that spot a little bit longer. But that's more or less the routine. Relatively simple and straightforward thing to do. Only takes about 5 minutes a day, but can have some really good benefits in terms of improving the elasticity, improving the mobility of the skin and the area around the scar, increasing comfort, decreasing pain with bending and different movements. So it can be a really beneficial thing to add and have as part of your rehab and physical therapy after surgery. So thank you very much for watching, everyone. Again, be sure to hit that like button. Be sure to subscribe and turn on the notifications so you can catch all of our newest videos about knee replacement surgery. And of course, leave your questions and comments below, and I'll be sure to get back to you. Thank you very much for watching.